Women were not allowed to participate in federally funded clinical trials as research subjects until 1993, which means all of modern medicine was built on evidence that only considered male biology.
Yeah.
1993, guys. Okay. Women, we know, respond differently to medications, but there's no research on how or why yet. There's a lot of gaps in research, I should say. We know they have different presentations of the same diseases, and that treatments need to take into consideration differences in sex in order to be effective, but that's not a priority for venture capital. We know today that women spend 25% more of their lives in poor health than men, and they account for nearly 80% of autoimmune diseases, many of which are related to oral health inflammation. By the way, if you have an oral inflammatory condition, that can really exacerbate autoimmune diseases and also inflammatory diseases. Many of these conditions disproportionately affect women and remain underdiagnosed and under-researched and poorly understood. And only a small percentage, as I said, a small percentage of healthcare investment capital is addressed to women's health innovation, and most of that is fertility. So if you think about that, 2% of health investment is going towards women's health, which means looking at how women's biology impacts or is affected by disease differently, medications differently, all of that. Women's health is not a niche. It's a half of our population that has not received adequate research, investment, or innovation.